Hi everyone, my name is Pearl Mukoro. I'm a Master's of Health Informatics student at George Mason University, and this presentation is done for the class HAP 725. This is a case study where I compare the performance of Medstar Georgetown University Hospital against several other hospitals. The source of data is from Centers for Medicare and Medicaid Services. It's the hospital compared data set, and I used a time frame from January 2013 to December 2017, and the data is available in zip files in this link. I decided to study complications and healthcare acquired infections across the hospitals to see how they stack up against each other. These are often important metrics that hospitals try to reduce, and in reducing them, the quality of patient care improves. So I decided to study these measures. The list of measures that I studied included healthcare acquired infections, which were broken down into Clostridium difficile cases and MRSA infections. I studied blood clot after surgery, heart failure readmission rates, and the overall patient satisfaction score. One limitation that I encountered is that not all years were available for some of these measures. Another limitation of this study is that only a few measures are used to compare Medstar Georgetown to its competitors. There are about 123 measures in this data set, and only using 5 cannot accurately give us a full picture of how our hospital is performing. I decided to select these hospitals because they were located in the DC and Virginia area, and they also shared some similar characteristics where some of them were university hospitals, some of them had the same size, etc. The hospital competitors include Sibley Memorial Hospital, Howard University Hospital, Providence Hospital, Inova Fairfax Hospital, and Centara Norfolk General Hospital. Our first performance indicator is C. difficile infection cases, and is studied over time from 2013 to 2017. The graph shows that Medstar Georgetown's C. difficile infection cases have stayed within the upper control limit and lower control limit within this time period. However, it also seems to have trended somewhat downwards. Our second performance indicator is MRSA infections, and the graph shows that from 2013 to 2016, the number of infections went down. However, from 2016 to 2017, the number of infections went up. And although it was going up and down within this time period, it was within the upper control limit and lower control limit, with the exception of the end of 2017, where the cases of Medstar Georgetown University Hospital were above our upper control limit. Our third performance indicator is blood clot after surgery cases. The graph shows that from 2013 to 2015, the cases of blood clots after surgery were above our upper control limits. However, from the end of 2015 to 2017, the cases of blood clot after surgery went down and began to stay within the control limits. Our fourth performance indicator is heart failure 30-day readmission rate, and there are 3 time periods that were recorded for this measure: 2013, 2014, and 2015. The graph shows that the readmission rates from 2013 to 2014 reduced, and the rates from 2014 to 2015 increased. However, it stayed within our control limits during this time period. Our final measure is the overall hospital satisfaction score, and this is taken over time from 2014 to 2016. The results of this control chart show that our hospital satisfaction score for Georgetown University Hospital stayed the same or about the same from 2014 to 2015. However, it slightly increased from 88 to 89 from 2015 to 2016. Although there was a slight increase towards the end of the year, um, these scores stayed within the control limits. In summary, Medstar Georgetown Hospital performs as well as its competitors when it comes to C. difficile infections, hospital satisfaction score, and heart failure 30-day readmission rate. However, it performs poorer than its competitors when it comes to MRSA infections and blood clots after surgery. This concludes my presentation, and thank you so much for listening.